Hi, my name is Rosa Diaz. I'm going to talk about emphysema. I'm going to talk about causes, signs and symptoms, treatments. I choose this disorder because I see that in the last few years, this disorder has been increasing in patient numbers. Okay, let's see. What is emphysema? It is included in a group of disease of COPD. As you can see, COPD, chronic obstructive pulmonary disease. Chronic means long-term. Obstructive, in this case, it means the air is going to get trapped inside of the lungs. Pulmonary, as just said it, lungs. It is a long-term progressive disease. A shortness of breath due to the overinflation of the alveoli, and the alveoli and lung tissue are destroyed, making it very difficult for the patient to breathe. I'm gonna show you a picture of a normal alveoli here and a person with emphysema. As you can see here, the difference, you can see they really look different in these two pictures. The alveoli are a small cluster of little bubbles, like bunches of grapes, very fragile air sacs located at the end of the bronchial tubes, deep inside the lungs. In emphysema, the inner walls of the air sac weaken and eventually rupture, creating one larger space instead of many small ones. You can see here this large space instead of the many small ones like on the normal alveoli. With this damage, the alveoli cannot support the bronchial tubes, the air that is coming through the bronchial tubes. The tubes collapse and cause blockage, which traps air inside the lungs. As you can see here, in this case, if the bronchial tube is going to collapse, and it's going to be hard for the patient is not going to have any problems breathing inhaling air. The problem is going to be when exhaling, because the air gets trapped here. They cannot get out because of the damage in the alveoli and the damage on the bronchial tube. That's why the people have a lot of problems exhaling. You're gonna look at them with they're trying to push out the air. Breathing in is no problem. The problem is breathing out. They always gonna be like pushing out the air because it's trapped in the alveoli. Let's see. Emphysema. Over 3 million people in the U.S. have been diagnosed with emphysema. Usually diagnosed during the ages of 50 and 70, between the ages of 50 and 70. But most of the people have emphysema the early 40s. They just don't know that they have this disease because most of the time they only have shortness of breath. And with shortness of breath, they probably gonna mistake it for something else. They're not gonna think that they have emphysema. Usually symptoms might not be noticed until 50% or more of the lung tissue has been destroyed. As I told you, this disorder gradually starts getting worse, and the emphysema can last for many years without noticing any signs and symptoms, only the shortness of breath. It's more common on men than women. Studies show that the amount of women with the disease is gradually increasing. There is no cure, but treatment will slow the progression of the disease. The The main cause of emphysema, it's cigarette smoking. That's the number one cause. It's the most dangerous behavior that causes people to develop emphysema. Smoking irritates the airway and causes inflammation. Lung tissue is also destroyed in the process. This is the most common cause, but at the same time is the most preventable. Air pollution acts in a similar manner to cigarette smoke. Rarely caused by an inherited condition known as alpha-1 antitrypsin deficiency. It's a protein that protects the elastic structures in the lungs. The deficiency is congenital, that is, people are born with it. Older age is another cause of emphysema because the normal function of the lungs decline with age. Signs and symptoms. As emphysema progresses, the muscles that help on breathing must work harder. Also, they tire out sooner. The first symptom is shortness of breath, which can last for years. This is the most common symptoms. Shortness of breath start getting worse even after the slightest activity or while at rest. In addition, they're gonna start having wheezing. They're gonna have cough that does not go away. Usually, sometimes refers as the smoker's cough. Also, the chronic mucus production because of the overproduction of phlegm. The tolerance to exercises decreases as well because the people have so much difficult breathing out. Any very little exercise that they do, they're gonna get tired very soon. They also have the barrel-like distended chest, of course, because the lungs are chronically overinflated with air, so the rib cage stays partially expanded all the time. Cyanosis of the lips and fingernails because the oxygen doesn't reach the way it should to the tissues. The pursed lip breathing, excuse me, because this is due to the struggling of exhaling completely. The person have problems breathing out the air. So that's why you're gonna notice the pursed lip when breathing out. The decreases in appetite as the diseases start getting worse. Because they get tired very easily. They also have poor sexual function. Treatment. Emphysema cannot be cured, but treatment can help with symptoms and slow the progression of the disease. The type of treatment will depend on the severity of the condition. Since the primary reason of this disease is smoking, the first recommendation to people will be just stop smoking. It sounds very easy, but for a lot of people, they have a lot of problems stopping because probably they start too early, very young age. But there are medications available to help in breaking the addiction of smoking. This will improve the lung function and quality of life. Also, bronchodilating medications will cause the air passages to open and allow better air exchange. The most common bronchodilator for mild cases of emphysema is albuterol. which is Proventil, Ventolin, ipratropium bromide, which is Atrovent. Steroid medication is another treatment that helps to decrease inflammation in the body and the lungs. One example of steroid medication will be singular. Antibiotics in case patient develops bronchitis or pneumonia. Therapy is part of the treatment too. Supplemental oxygen for severe emphysema with low blood oxygen levels. They can use it at home or when exercising. It might provide some relief. Therapy, pulmonary rehabilitation will teach breathing exercises. Surgery will depend on the severity of the disease. The doctor might suggest lung volume reduction surgery, which removes the damaged lung tissue and will help the remaining lung tissue expand and work better. Lung transplant is another option for if the other treatments fail. Okay, the most effective way to prevent emphysema is to avoid smoking cigarettes, since that is the first cause of the disease. Maintaining a healthy lifestyle, exercising regularly, eating properly, avoiding exposure to air pollution and secondhand smoke, and receiving prompt medical treatment for respiratory infections also can help prevent emphysema. Anyone who experiences symptoms of emphysema like shortness of breath, cough, difficulty of breathing while exercising, especially with a history of cigarette smoking, should see a physician as soon as possible. Getting rapid medical treatment can help slow the slow progression of the disease. Okay, I know emphysema is a more extensive topic, but I try to touch the most important part of it. Just try to talk a little bit of the most important parts of the signs and symptoms of the treatments of what is emphysema, and I have some of my reference here. And that's it. Thank you very much.